Hi, I'm Dr. Sam Lamb, facial plastic surgeon in Dallas, Texas. Today I'm going to talk to you about a basic primer on hair restoration, both involving medicine and surgery. So first of all, the medicine is so important oftentimes to help with hair loss, because if you have someone that is progressively losing hair and you move transplanted hair to the front or wherever it may be, and you're not on medical therapy, you can continue to lose hair and you may need more and more hair transplants to fix that situation, and you may run out of hair. So medical therapy, especially the younger you are, the more important that medical therapy can be. So medical therapy doesn't work in someone completely bald. If there's no hair there, medical therapy oftentimes fails. You want to catch the hair loss early on. There's two principal types of medical therapies: finasteride, which is usually oral but can be topical, and minoxidil, which is topical. Finasteride is usually used for men because there can be a birth defect in a woman during childbearing age if she's taking that. Minoxidil can be used for both, and they work together for a better result. So again, that hair loss that is occurring from thicker to thinner hairs called vellus or miniaturized hairs before it becomes bald is when you want that medical therapy to bring it back. So it can help hairs that are thinning before it becomes too late. And it's good over your lifetime to continue to treat medical hair loss in a way that it can prevent, or not prevent, but slow down progression of hair loss. Now, who is a good surgical candidate? Of course, you need to have a consultation with your facial plastic surgeon to make that decision. It's good for both men and women. But to understand it, you have to understand how hair transplantation works. It takes hair from the back of the scalp, which then move to the front or other areas of the scalp, actually behave just like the hairs on the back of the scalp. If you think of the baldest man, they have a horseshoe ring of hair back there that's still preserved. That hair is genetically programmed not to be lost. And when you move hair forward, it behaves just like that hair in the back. That's called donor dominance, and we've known that since the 1950s. There are two ways to move hair from front to back. You can move it through a strip procedure called FUT, or you can do FUE, where you're harvesting one hairs at a time. I'm not going to go through the pros and cons of those two methods. You're going to talk to your physician or your surgeon to get a better understanding of which role is better for you. I personally perform both of those techniques. But you need to understand a basic idea of who's safe to have hair transplant. It's a question of supply and demand. If you have a huge degree of loss and poor supply, you may not have enough hair to cover that area, and then you're not a good hair transplant candidate. But if you've got good hair in the back, oftentimes that can even cover a very bald scalp. So it's the question of how much supply do you have to fix how much demand you have. But also you have to factor in future loss. So what that means is, if you're a young person, your supply will continue to go down and your demand will continue to rise. So if you're a very young individual, especially a male, you may not be a good candidate to have hair surgery, because as you continue to get older, you may run out of usable hair. You may have a transplanted result that doesn't look natural. So you don't want to do a hair transplant in someone too young. For example, early 20s to mid 20s is usually too young. Now there are some exceptions to that rule. So that consultation with a qualified physician is so very, very important. So that is basically the general idea of hair loss and hair restoration that is good for both men and women. Some indications for hair loss would obviously be just male or female pattern hair loss. You can also have traumatic loss, either from eyebrows or scars, or from chemotherapy loss, things like that. But there are also medical conditions that are not acceptable for hair transplantation, such as frontal fibrosing alopecia, alopecia areata. These are types of dermatologic conditions that are not acceptable for hair restoration with hair transplantation. Now, what do they look like? Well, that's something, again, you go to a qualified facial plastic surgeon who does hair restoration, and that person can counsel you on whether you're a safe candidate to have hair restoration or not. So just remember, trust your face to your facial plastic surgeon. And if you have more questions about who we are as facial plastic surgeons, go to www.aafprs.org. Thank you very much.